try not to feel like because my child has autism, they're not going to be able to do anything. Your child with autism can do so much. Have those high expectations.
It's often quite difficult for parents to figure out what's the best intervention for their child. How do you prioritize intervention to meet that family's needs or to meet that child's or individual's needs? Interventions for people with autism should be prioritized depending on the child's age, their developmental level, their level of education, and the presence of negative behaviors. If the child is engaging in destructive, aggressive, or potentially dangerous behaviors, the priority should be to reduce those before working on any other skill development. The child will be unable to expand communication if any frustration leads to aggression.
All behavior occurs for some reason. It might be to get out of doing something we don't want to do. It might be to get access to things we want or to people we want. And so it's really important that we identify those reasons behind behavior.
Same behavior, say hitting, for example, could be there for a variety of reasons. The child may hit because a routine was changed and they didn't like that the routine was changed. A child may hit to communicate that he or she is upset, or to communicate that he or she is hurting, or feeling uncomfortable with an article of clothing that feels scratchy or itchy.
So you think about if you can't communicate or you can't communicate functionally, how are you going to get your needs and wants known? And especially with a child with autism, they have difficult time with gesturing. So with pointing to whatever it is that they want, or saying, I don't know, or it was this big. Those gestures a lot of times don't come naturally. So that leads to even more frustration with communication. When you get that frustrated, you're going to have a behavior. You're going to want to tantrum on the floor because no one understands what you want. They don't understand what you're saying. They can't read your mind. And you're just letting it out the only way you know how. When you start to work with communication devices, with PECs, with showing a child what they need to do in order to get their needs and wants met, the negative behavior should start to decrease at that point.
We don't have great medicines for helping behavioral problems in autism, but if you can help sleep, if a child can be sleeping better, it makes all the difference in terms of their behavior. So then you've not only improved their sleep, you've improved their behavior as well. You've also improved family functioning and family quality of life, because if a child is waking up at 2 in the morning, it's going to take a toll on the families, and they're not going to be able to fully advocate for their child the next day. So we really want to focus in on improving sleep because it's a great opportunity to improve behavior.
Push your child, keep them just beyond, keep pushing just beyond where they are so that they're continuing to progress, and it makes your child feel so much more confident in themselves and their abilities the more independent they are. They don't want to rely on you for everything if they don't have to.
Persistence is hard during these very trying times, but it is key for success when working with very challenging behaviors like aggression or self-injurious behaviors.